Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another DABT topic, that is acute intravascular hemolysis. So this question is taken from ABT recertification question 12 2000. So the question is acute intravascular hemolysis may follow exposure to. So we need to identify which of the following chemicals will cause acute intravascular hemolysis. Eventually we'll also read what is intravascular hemolysis, acute and chronic, what is extravascular hemolysis also, that you have to read. Okay, so first option is option A, that is naphthalene. Second option is stibine. Third option is phenylhydrazine. Fourth option is harcine. The right answer is the green text, that is option E. All four: naphthalene, stibine, phenylhydrazine, and arsine. All these things four are going to cause acute intravascular hemolysis. Let's understand the each and every option, how the mechanism is, how they are going to disrupt your RBC membrane, and how they are going to cause the rupture of this one, and how they are going to release the contents out of the RBC, that we will see. First is in the case of clinical toxicology. So this comes under, if you look into ABT brochure also, this comes under the category clinical toxicology. Okay. All four substances are recognized as potential causes of causing this acute intravascular hemolysis. So option 1 will see naphthalene. Naphthalene exposure to this naphthalene can lead to oxidative stress in the case of RBC. So one of the another basic mechanism that any cell undergoes any kind of either it is necrosis, apoptosis, one of the method is generation of this reactive oxygen species or reactive nitrogen species, which further will cause oxidative stress to the cell. As a result, the cell will undergo death. So the mechanism here is this naphthalene is going to cause oxidative stress in the case of RBC. The process can cause the cells to rupture, resulting in hemolysis. That is only our question is, particularly in the individuals with certain enzyme deficiency. There are certain individuals who are having G6PD deficiency. So those can be those human beings which are having G6PD deficiency, glucose 6 phosphate dehydrogenase deficiency, which is a part of your glucolysic gluconeogenesis. If you go back to your biochemistry and read, no, this pathway will be there. So that particular pathway who are going to have this deficiency in this particular enzyme, they are more susceptible to cause by the exposure of this naphthalene, this type of oxidative stress in the RBC, thereby which will lead to intravascular hemolysis. Okay. Second one is stibine. Stibine is a hemolytic agent. Okay, and this inhalation, whenever this gas is stibine, when the workers who are working in the factories, if they are exposed to this stibine gas, no, can lead to rapid destruction of the RBC within the blood vessels. So when the RBC will be flowing in the blood vessels, no, there the disruption takes place, often followed by hemoglobinuria. So there is a decrease in the hemoglobin in this particular type of exposed individuals. That was with respect to stibine. Now we'll see third option, that is phenylhydrazine. It's a potent oxidant. Okay, how it is going to cause this phenylhydrazine? It will induce hemolysis by creating reactive oxygen species. As I told you before, oxidative stress, there will be generation of ROS or RNS. So here they're going to generate ROS that damage the hemoglobin. Hemoglobin, you have to remember that the structure of hemoglobin also, two light chains, two heavy chains, how they are bind, the ring, porphyrin, everything you have to remember. You have to whenever you're reading, you have to think, then only you can understand. So it is going to damage the hemoglobin and the red blood cell membrane, whatever this membrane is done, that membrane disrupture is going to cause this particular phenylhydrazine. And coming to last option, that is arsine. Arsine gas is recognized for its high hemolytic activity, similar to like of stibine. So whenever you inhale this, the workers who are working in the factories where they get exposed to this arsine, when they inhale this arsine gas, no, cause significant and rapid intravascular hemolysis. So intra means within the cell, within the RBC cell. There is a breakage of this one shortly after exposure, which may lead to serious complications such as renal failure, that is kidney failure, due to the release of this hemoglobin. Hemoglobin will be released in high amounts, where that because of which kidney get exposed to these high concentrations of hemoglobin, and which will result into kidney failure. So what you have to remember with respect to exam or with respect to as a risk assessment toxicologist is that See, naphthalene you will get in the your as an impurity in lot of your pharmaceutical production or other type of chemical productions. Okay, there naphthalene you will be doing risk assessment. And coming to naphthalene, no, you have to remember the structure of naphthalene. Either it is two benzene ring fused like anthracene, phenanthracene, or three benzene ring fused. Did you have to keep chemistry also in mind when you are reading about naphthalene? Coming to stibine and arsine, these are the gases which are released when working in the factories. So that also you have to remember, and phenyl hydrogen. So these might be part of as an impurities also. When you have your specification, there also you have to do the risk assessment. So remember, when you're reading, integrate everything and try to read it so that you can remember at the time of your exam. Arsine you will keep coming across other type of solvents also. Then next we have, let us understand the definition of acute intravascular hemolysis. One or two slides only will discuss. So we have, it's a rapid, life-threatening destruction of RBC directly within the bloodstream, as we saw in the blood vessels also, releasing the free hemoglobin into the plasma. So hemoglobin HB will be released into the plasma, and if that is going and going to the kidney, it will cause kidney damage also. It causes profound anemia, hemoglobinuria, that is dark urine will be there because of the hemoglobin concentration in the urine, and potential renal failure, which we have seen, and often resulting from ABO incompatible transfusion. So whenever there is ABO incompatible blood transfusion is taking place, so at the time of blood transfusion also, you have to be very careful. Infections like malaria and autoimmune reactions. So these are the cases, these are the incidents where this part of, in these cases, there is high risk of causing this intravascular hemolysis. Next one is, what are the key and important aspects that you have to can remember with respect to intravascular hemolysis is pathophysiology. RBC membrane damage occurs within blood vessels, often driven by complement system activation. If you see first paragraph, no, that activation system I have shown you. Mechanical shear, that is membrane. You have to remember when it comes to hemoglobin structure also, no, RBC structure, RBC can fold whenever the narrow blood vessels, high blood vessels, it can fold. The K shape of the RBC cell is biconcave. There's some physical that advantage RBC cell as when compared to other cells, and it is enucleated also, that you have to remember when you're reading things like that and read. That's why mechanical shear they're talking. Heart valves, DIC, that is disseminated intravascular coagulation or toxins. So that was about the pathophysiology. Clinical presentation. Patients typically present with sudden fever. So what they're showing: fever, chills, backache, nausea, vomiting, hemoglobinuria, that is dark and black urine, signs of anemia, that is fatigue and tachycardia, increase in the heart rate. Coming to third one, that is laboratory findings. What you can see there, when you perform plasma or this serum analysis, you will see increase in the LDH value, that is lactate dehydrogenase, which act as a biomarker, decreased hepatoglobin, high plasma free hemoglobin, and increased direct bilirubin levels. Okay, what are the causes? Causes are include acute hemolytic transfusion reactions. We have seen, whenever there is ABO incompatibility transfusions, severe infections like in the case of malaria or clostridium infections are there, mechanical damage, that is in the case of here we have seen, example, heart valves, and autoimmune disorders, and sometimes we have seen the G6PD deficiency also. Coming to management, how we are going to address this intravascular hemolysis in the case of individuals. Treatment depends on the cause, but often includes immediate cessation, means stop of this causative agent. If we know that because of this particular agent, this intravascular hemolysis is there, then you have to stop. Cessation, complete cessation, immediate cessation. Stopping of the blood transfusion, aggressive hydration to manage hemoglobinuria, and treating the underlying disease. If there is any autoimmune disorders, autoimmune reactions are there, G6PD deficiency something is there, then you have to treat the underlying disease. Okay. Now we'll see common complications, as we have seen acute kidney injuries. Second one was DIC, that is disseminated intravascular coagulation and circulatory shock. How we are going to diagnose? By uh, looking into this urine sample. If it is dark and brown color, one will be, which is free of hemoglobin. One of the thing, we can't come to conclusion with only with this one particular diagnosis. Blood film, that is blood film, presence of schistocysis, fragmented red cells, and third one is direct antiglobulin test, that is DAT, often positive in the case of immune mediated hemolysis. So another question that we can come across with respect to arsine, one option was arsine, no? So from another textbook I have seen. So which of the following is not true about arsine? Arsine not true. So arsine is gaseous at room temperature, right? It produces acute intravascular hemolysis, right? Has garlic-like odor. Very important. There are, if you look into clinical toxicology, no, you go back and check. There is a table in the Clayson textbook also. They'll give you different types of odor. Okay, in that garlic, those chemicals which show garlic type odor also you will come across. Okay, so in that arsine is listed, that you have to remember. Okay, so arsine is having garlic like odor. Acute renal failure is a common manifestation of the arsine poisoning. Why? Because hemoglobin levels increases, reaches the kidney, and it is going to cause kidney toxicity. Significant liver toxicity often occurs as a part of arsenic poisoning. We did not come across kidney as a target organ. We didn't come across all the four options, whether it was naphthalene, whether it was arsine, whether it was T-bine, or whether it was, I don't know what was the last option. So in none of the four has any possibility of causing any liver toxicity. So hope you can pause here and read the mechanism how it is causing hemoglobinuria. Okay, you can pause here also and see that I told you no. This question what was with respect to intravascular hemolysis. I want you to go back and read what is extravascular hemolysis. What are the drugs or the disease conditions which are causing extravascular hemolysis? So any question with respect to extravascular hemolysis also we will be able to understand. If you get if time permits us, we'll definitely make another video on extravascular hemolysis. So thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. All the best for your exam.